Hello, future doctors and nurses. Today we're diving into the intricate world of the median nerve. This nerve is like a bustling highway carrying crucial signals between your brain and your hand. Without it, simple tasks like buttoning your shirt or typing on your phone would be impossible. Imagine the median nerve as a dedicated messenger, relaying commands for movement and sensations like touch, temperature, and even pain. It's responsible for the dexterity and sensitivity that allows us to perform intricate tasks with our hands. Understanding the median nerve is essential in medicine. It helps us diagnose and treat a range of conditions, from carpal tunnel syndrome to traumatic nerve injuries. So let's put on our anatomical hats and explore the fascinating journey of the median nerve, from its origin to its impact on our daily lives. Our journey begins deep within the shoulder at a complex network of nerves called the brachial plexus. Picture this, a network of interlacing nerves like a busy roundabout, directing traffic to different parts of the arm. The median nerve arises from this network, drawing its roots from the C5, C6, C7, C8 and T1 nerve roots. It's like a powerful river formed by the confluence of several smaller streams. These roots carry nerve fibers from the spinal cord, which is like the main control center. These fibers are bundled together, forming the median nerve, ready to embark on its journey down the arm. In the next section, we'll follow the median nerve as it navigates through the arm, forearm, and into the hand. As the median nerve descends from the brachial plexus, it embarks on a carefully charted course through the arm. Imagine it as a skilled explorer navigating its way through a complex landscape of muscles, bones, and other tissues. It travels down the arm alongside the brachial artery, a major blood vessel supplying the arm. This duo, the median nerve and brachial artery, run together like two close companions, their paths intertwined. As the median nerve reaches the elbow, it passes through a tight space called the cubital fossa. This area, often referred to as the elbow pit, is a crucial landmark for healthcare professionals. Continuing its journey, the median nerve then enters the forearm, passing between two muscles, the flexor digitorum superficialis and the flexor digitorum profundus. These muscles, as their names suggest, play a vital role in flexing the fingers. Now let's talk about the median nerve's role as a puppet master, controlling the intricate movements of our hands. It innervates a group of muscles in the forearm and hand, acting like invisible strings that make our fingers dance. In the forearm, the median nerve innervates the pronator teres and the flexor carpi radialis, muscles responsible for turning your palm down and flexing your wrist. It also controls the flexor digitorum superficialis, which allows you to bend the middle knuckles of your fingers. Venturing into the hand, the median nerve innervates the thenar muscles located at the base of the thumb. These muscles are crucial for thumb opposition, the movement that lets you touch your thumb to your other fingertips. This seemingly simple action is actually quite complex and essential for tasks like gripping objects and writing. The median nerve also innervates the first and second lumbrical muscles, which help with fine finger movements. These muscles allow you to make delicate adjustments to your grip, like picking up a small object or playing a musical instrument. Every nerve in your body has a calling card, its nerve root value. This value tells us which segments of the spinal cord contribute to the nerve's formation. It's like a unique identifier, helping medical professionals pinpoint the origin of nerve problems. The median nerve's calling card is C5, C6, C7, C8, and T1. This means it receives contributions from 5 different spinal nerve roots, making it a nerve with diverse origins. Understanding the nerve root value is crucial for diagnosing nerve injuries. For instance, if a patient experiences weakness in their hand and a doctor knows the median nerve's root value, they can investigate for potential issues at those specific spinal levels. So the next time you hear nerve root value, remember, it's like a detective's clue, revealing valuable information about a nerve's origin and potential problems. The median nerve is a multitasker, playing a vital role in both sensation and movement. It's like a two-way street, carrying information about touch and movement between your brain and your hand. On the sensory side, the median nerve provides sensation to the palm side of your thumb, index, middle, and half of your ring finger. It allows you to feel textures, temperatures, and even pain in those fingers. This sensory information is crucial for everyday tasks. Imagine trying to button your shirt without feeling the buttons, or pick up a hot cup of coffee without feeling the heat. Nearly impossible. On the motor side, as we discussed earlier, the median nerve innervates muscles that control thumb movements, wrist flexion, and finger flexion. This motor control allows you to perform intricate tasks like writing, typing, and buttoning your clothes. The median nerve's dual role in sensation and movement highlights its importance in hand function. Any damage to this nerve can significantly impact your ability to perform even the simplest tasks. Now let's delve into a common condition that affects the median nerve: carpal tunnel syndrome. This condition occurs when the median nerve gets compressed as it passes through the carpal tunnel in your wrist. Imagine the carpal tunnel as a narrow passageway with the median nerve and tendons running through it. When the tissues surrounding the tendons in the carpal tunnel swell, they put pressure on the median nerve, like squeezing a garden hose. This pressure can cause a variety of symptoms, including numbness or tingling in the thumb, index, middle, and half of the ring finger. Pain in the hand and wrist, sometimes radiating up the arm. Weakness in the hand, making it difficult to grip objects. A feeling of swelling in the hand, even if it doesn't look swollen. Carpal tunnel syndrome is often caused by repetitive hand movements, such as typing, using a computer mouse, or playing certain musical instruments. Other risk factors include pregnancy, obesity, diabetes, and arthritis. Treatment for carpal tunnel syndrome typically starts with conservative measures like wearing a wrist splint at night, avoiding activities that worsen symptoms, and taking over-the-counter pain relievers. If conservative measures fail, your doctor might recommend corticosteroid injections to reduce inflammation in the carpal tunnel. In more severe cases, surgery might be necessary to relieve pressure on the median nerve. Carpal tunnel syndrome is a common but treatable condition. Early diagnosis and treatment are essential to prevent permanent nerve damage and preserve hand function. While carpal tunnel syndrome is the most well-known condition affecting the median nerve, it's not the only one. Other disorders can also disrupt the nerve's function, leading to a range of symptoms. One such condition is pronator teres syndrome, where the median nerve gets compressed as it passes through the pronator teres muscle in the forearm. This can cause pain and numbness in the hand, similar to carpal tunnel syndrome, but the symptoms typically occur on the palm side of the forearm. Another condition is anterior interosseous nerve, AIN syndrome, where a branch of the median nerve gets compressed in the forearm. This can cause weakness in specific hand muscles, making it difficult to pinch or make an OK sign with your thumb and index finger. Traumatic injuries, such as fractures or deep cuts, can also damage the median nerve. These injuries can cause a range of symptoms, from numbness and weakness to complete paralysis of the hand, depending on the severity and location of the damage. Diagnosing and treating these conditions often require a thorough physical exam, nerve conduction studies to assess nerve function, and imaging tests like X-rays or MRIs to rule out other causes. As we conclude our journey through the anatomy and clinical significance of the median nerve, remember that this nerve is a vital player in hand function. From its origin in the brachial plexus to its innervation of muscles in the hand, the median nerve plays a crucial role in our ability to perform intricate tasks and experience the world through touch. Understanding the median nerve's course, functions, and potential problems is essential for medical professionals. It allows us to diagnose and treat a wide range of conditions, from carpal tunnel syndrome to traumatic nerve injuries, and ultimately help our patients regain function and improve their quality of life. Keep exploring, keep asking questions, and never stop learning. The human body is a fascinating and complex machine, and the more we understand about it, the better equipped we are to care for it.